What are you doing up? It's a little late. Yeah. Just couldn't sleep. I understand that. Well, I've got a few things that I need to check with you. So, really, that works a little bit better for the both of us. So, I'm just going to have you take a deep breath in when you feel the diaphragm of my stethoscope on your chest. So, I could have you just inhale. Inhale. Exhale. Inhale. Inhale, exhale. Good. Inhale, exhale. Last row. Inhale and exhale. Inhale. Okay, so lungs sound great. I'm just going to take a little listen to your heart. We'll start right up here and just keep breathing normally. Is there any particular reason why you couldn't sleep? Mm-hmm. I see. Is there anything that I could do to make this a little bit more of a comfortable stay for you? I could grab another blanket if you want, an extra pillow maybe, a glass of water. Yeah, it's just one of those nights. I understand. Why don't we go ahead and grab your temperature real quick. So, I'm just gonna have you hold still. Just gonna swipe that over. Good. Okay, clear that out. We had a nice temperature. 0.3 degrees Fahrenheit. Very good. And then let me grab my sphygmomanometer. I know, the favorite. I'm just going to put this right here. I'm working with a little bit of limited room. Do you have any preference as to which arm we take your blood pressure from? Okay, so we'll come right here. just have you slip your arm in the cuff here, and then we'll tighten that. Okay. So here I've got our dial that gives us our pressure reading in millimeters of mercury right here, and it has an easy little clip here that I can just attach to the cuff. So let me just see that, and we'll just put that right there. Lastly, we have our little bulb, and let's see, is this, so that's all the way out. This little dial releases air, so we're just going to make sure that's nice and snug. And then I am going to be putting my diaphragm here in the crook of the elbow. So right in here. And with the other hand, just going to inflate the cuff. So this will be quite firm, it can be quite uncomfortable, but I tend to be a pretty quick read. So we're just going to gently inflate the cuff and get our reading. I do take 2 readings. It tends to be a little bit more accurate on the second. And release some of the air there. Okay. And let that go. Good. Okay. We're going to tighten that back up. And let's go again. This one is a little quicker. And right there, and then right there. Okay. I am just going to jot that down real quick while I have that in my head. 80 millimeters of mercury. Pretty standard generally. Okay. Go ahead and just take this. There we are. Now, let me grab the dial first, and then the cuff here. Loosen that. And then you can go ahead and slip your arm out. Good. And then I'll just gather that up. Good, good. Now, I have a little clip here. This is a little device that measures your oxygen levels as well as your pulse. So I'm just going to have you put out your index finger. Okay, let me just clip that on. So we'll get our pulse and we'll get our oxygen saturation from the oximeter there. Give it just a few seconds. Just a little bit of it. And what do we got? Okay. Excellent. Let me take that back. Okay. is I'd rather do this at the beginning so that if you do start feeling sleepy, I'm not startling you awake later on. Now, I must warn you, the light is a little bright, okay? So, we'll be quick about it. Let's go ahead and keep an eye on my nose here. Alright. Good. That's not too bad. Okay, good. Just keep looking at my nose. Good. That's right. And we're just looking at the pupillary response. I had a little peruse in your chart, and it looks like that's been quite normal. So, we're just making sure that stays normal. There we are. And let's try a little bit of a different direction. Good. Good. Excellent. There we are. Good. Can you look at our little fabric divider right back here? Just look at that for a few moments. Okay. And can you look at the light? Good. And look at the sheet here. And look at the light. Okay, back at our divider. And the light. Good. Now, you don't have to look at the light now. I'm just going to take a little look at your eyes. Have you been dealing with any pain or any symptoms since we last had a nurse check in on you? Okay, that's good to hear. I'll note that down in our chart. Good. Just taking a little look at everything while I'm here. Good. And can you just tilt your head back so I can look inside the nose? Good. Okay, that looks good. And if I could have you just open your mouth. Okay. I'm gonna take a little peek in there. Good. Good. Can you say ah for me? Mm-hmm. Okay, excellent. Go ahead and close your mouth. Lastly, I want to move away from the head after looking at your ears real quick. Let's see. Just need a new speculum. And set Otoscope. Click that into place. Line that, and there we are. So I'm gonna have you just lean forward a bit so that I can get to this ear. Okay. Alright, so it looks like there's a tinge of redness in there, but otherwise looks like the canal is clear. And the tympanic membrane is intact. of infection or anything like that. Let's just look over here now and see if this side tells the same story, which it looks like it is, which is excellent. I want to make sure that there's nothing going on. It all looks great. I hit a couple of reflexes and just make sure that's all good. Can I have your arm, please? Okay, I'm just gonna hold on to it with my hand here. I'm gonna be tapping on my thumb, which is just gonna rest in the crook of your elbow here. Good. And let's do, so I'm going to just lift up your leg here and arrange it how I need it to get the patellar reflex while you're lying down here. Just gonna pick this up. I'm going to put you just like that. And then just going to and then the other side, so we're going to bend like that, so that we have right here. Yeah, that'll do. Good. Reflexes are intact here. Spot I want to hit here. Do you have any pain in your abdomen at all? Okay, so I'm going to do a little palpation here. Let me know if there's any pain or tenderness as I'm pushing around a bit, using one hand to start. Okay, and then let's do two hands. No pain, no tenderness. Okay, let me just feel around. So we've got the liver here, normal spleen. See if we've got the kidneys here. Okay. Yeah. Alright. So, abdominal exam. Just fine. So, that's it for all of our little metrics that we need. Are you feeling any sleepier at all? No, not really. Okay. Well, I do have a little bit of time before I have something else to do. So, if you want, I have a few things lying around. We could see if we can get you to feel a little bit more relaxed. Yeah? Okay. First thing, it's a little bright in here, isn't it? A little bit, yeah. So, why don't I turn down the lights just a little bit, and we'll see what I've got in my little bag of tricks here. That's a little bit better. Are you all tucked in? Yeah, okay. Yeah, looks like it. Snug as a bug in a rug. So, let's see. I've got a couple of nice for my more neurodivergent people, or for kids, or people who have anxiety, people who have issues with dissociation. You can even use these when we are doing blood draws as well. Try to confuse the body's pain signals. So let me just show you. This is what that feels like here on your leg. Very soft. But it's just that little bit sensation. It's mild, it's dull. Your feet. I try to keep a couple of these on hand. Just to help ground someone a little bit. Without having to directly touch someone. These can be cleaned, sanitized, sterilized. Just on your arm here. There we are. Just a little bit. Now, these can be a little rough for the face. So I try to keep these more for fingers. Do both at the same time. Or just one side. It's quite nice. I do have actually a little medical test that people find very soothing for some reason. Let me grab those out. So, I have here a little paintbrush here. And a Wartenberg pinwheel. And we use this for neurological testing to test your nerves. So we ask the patient, do you feel a soft touch or a sharp? There's many different kinds of touch, and these ones are very easy to measure. It just tells us the nerves are functioning okay. So this is what the soft touch feels like on your arm. And this is what a sharp touch feels like. Just like that. So I'm going to have you close your eyes. Close your eyes, and I'll just ask you if you feel the soft touch here or the sharp. Okay? Alright, let's start with your arm. So, soft or sharp? Soft, sharp, 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 soft, 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 sharp, soft. Good. Let's move on to your legs here. So this is soft. Okay. And this is sharp. So keep your eyes closed. Soft or sharp? Soft. Soft. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. There are a couple other tools in my little bag of tricks. I use these for patients that are dealing with muscle pain due to tightness, as especially in the fascia, especially people that might have any sort of injuries that didn't quite heal right. They need a little bit of extra work and just a little massage. Use these tools. Help break up those attachments in the fascia. Scar tissue, maybe. So, these work excellently on the legs if you want me to do a little bit of rolling on you. Okay, let's go ahead and just start a little more gently with this guy. And I'm going to stick on the more meatier parts of the thigh. You could also use this on the calf, the back. But we're going to stick right around this area and the lateral edge. I'm not going to go so hard like I might with a patient that we're trying to treat, trying to use this as a therapeutic intervention. But instead, just using this more for the pressure, the sensation. How is that pressure? Good. This side. Just trying to warm everything up a little. Barely putting any weight on there. Then at least you shouldn't have any muscle tension in your legs when you go back to sleep. Let's bring out the other roller here. Just a little bit more pressure here. Nothing too heavy. Like the little click of the wood gears against each other. the occasional little tapping sound of the roller combined with the gentle pressure from the wood, from the tool. Let's bring back in our little cube roller. And I'm more moving in a little more of an abstract way. Just trying to get full contact of the wood with the muscles underneath. Pressure's still okay. Good. Let me just put these down. Quite a few things in the bag of tricks. Now, anything we can do to make you any more comfortable. Okay. Well, I would like to just listen to your lungs one more time. So, I'm gonna have you take a deep breath in and out. 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 sleepier yet. Yeah, that's the trick right there. Just doing the nice, long, deep breath. And that tends to at least make everything just a little bit dreamier, a little easier to be present. Let me just finish up my notes. I think it's been long enough now that we can take a listen to the abdomen. It's a good thing I caught that. So, just keep breathing normally. I'm just going to listen around the abdomen. Digestive sounds primarily. That's why we keep meticulous notes. Make sure that we got everything. It's very important to be thorough. Listen over our renal arteries here. Good. Now we can jot that down. Oh gosh, it's quite late. Slide my nail here. Okay. Alright. Well, your only assignment now is just to get some rest, okay? I'll keep the lights down low, and I hope you end up getting some good sleep. And I hope tomorrow you have a whale of a day. But for now, I hope you have a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you'd like to help support the channel, I have a link to my Patreon in the description box below. I offer perks like early access and ad-free access to videos, Patreon exclusive videos, and audio downloads of all my content. thank you so much for being here.